Losing someone is not always as simple as death. Sometimes the person you love fades away slowly, their mind slipping before their body does. This is the brutal reality for families and caregivers of people with Alzheimer's and other degenerative diseases. They watch helplessly as personalities shift, memories vanish, and once familiar faces become unrecognizable. This is a unique kind of loss it's grief stretched over months or years. Caregivers, often the unsung heroes in these situations, bear the emotional weight of caring for their loved ones and preparing for the inevitable goodbye. It's mentally and physically exhausting, and the toll it takes is undeniable. This slideshow explores how memory loss and death impacts caregivers, focusing on the deep emotional and psychological struggles they endure. Using personal narratives like Rachel Kazi Ganash's My Mother's House and reports from the Alzheimer's Association, along with scholarly research. Diving into the overwhelming burden caregivers face, discussing anticipatory grief, long-term effects of caregiving, and the struggle of finding support in a world that often overlooks their pain. Most importantly, highlight possible solutions because while loss is inevitable, suffering in silence shouldn't be. Alzheimer's disease isn't just about forgetting names or misplacing keys. It's about a person losing pieces of themselves one by one. Unlike the finality of death, Alzheimer's is a slow unraveling of identity, and caregivers witness it all. Ganash's My Mother House paints a raw and heartbreaking picture of what it's like to care for someone with this disease. Watching her mother disappear into confusion, the frustration being unrecognized, and the exhaustion of maintaining both care and composure. This experience isn't unique. According to the Alzheimer's Association, over 11 million people in the U.S. provide unpaid care for loved ones with this disease. Many spend over 18 hours a week caring for their loved one or for a patient on top of juggling responsibilities. And the mental strain is staggering. Imagine pouring your heart into caring for someone who, one day, may look at you like a stranger. That emotional roller coaster leads to high rates of depression, anxiety, and burnout among caregivers, and the grief of losing someone in slow motion is a unique kind of torture, and yet it's rarely discussed enough. Most people think of grief as something that comes after death, but for caregivers, it often starts long before. This is called anticipatory grief, the sadness and mourning that happen while watching a loved one decline. It's knowing what's coming and being powerless to stop it. Research by Sadafini, a professor and a PhD in nursing, describes and suggests this type of grief can be painful in the morning that follows death, sometimes even worse. For caregivers of Alzheimer's patients, it means mourning different pieces of their loved ones over time, their memories, their personalities, and their ability to recognize one's loved ones. This emotional toll isn't limited to Alzheimer's. Studies show on caregivers of cancer patients reveal similar struggles. Watching someone you love slowly fade, whether from disease or cognitive decline, it's crushing. Liz, a psychologist and professor in the Department of Psychology in Bradford University, points out that anticipatory grief can lead to emotional numbness where caregivers start detaching to protect themselves from inevitable heartbreak. It's a survival instinct, but it can also create guilt. Shouldn't they be more present, more patient, and more loving? These conflicting emotions already make an already difficult situation even harder. The stress of caregiving is more than just emotional. It can also have severe physical consequences. Studies show that long-term caregivers experience higher levels of cortisol, the stress hormone, which can lead in increased risk of heart disease, hypertension, and weakened immune system function. The Alzheimer's Association reports over 60% of caregivers rate their stress levels as high or very high. Chronic stress can manifest in insomnia and fatigue, and even cognitive decline in caregivers themselves. Caregivers also face significant mental health challenges. Depression and anxiety are common, even exacerbated by isolation that caregiving brings. Many caregivers reduce social interactions due to time constraints or emotional exhaustion, leading to loneliness and even resentment. The mental or physical exhaustion of caregiving is a heavy burden, and yet many caregivers feel guilty expressing their struggles, as they acknowledge their pain means they love their family members any less. Caregivers must develop coping mechanisms to maintain their emotional and physical well-being. One effective strategy is joining support groups, which provide a sense of community, shared understanding, and according to the Alzheimer's Association, caregivers who participate in these groups report lower stress levels and feel less isolated. Additionally, mindfulness and relaxation techniques such as meditation, deep breathing, and journaling can help caregivers manage their emotional responses. Sedafini found that structured mindfulness programs reduce stress, anxiety, and among caregivers, improving their mental health. Respite care is another essential resource. Caregivers often hesitate to take breaks, fearing that stepping away might be perceived as neglect. However, studies show that short-term relief, whether through professional respite services or family support, can significantly reduce burnout and improve long-term capabilities. When death finally arrives, many caregivers expect relief or a sense of closure, but the reality is often far messier. After years of providing care, many are left emotionally drained, struggling to process their grief in healthy ways. Schultz, a nationally recognized researcher of adult development and aging, described this as complicated grief. When mourning becomes prolonged or overwhelming for caregivers, it's not just the loss of a loved one anymore. It's a loss of purpose, routine, and identity. They spent so long focused on someone else's needs, they don't know how to function without that responsibility. Without proper support, caregivers can spiral into long-term mental health struggles, like depression or PTSD, and yet many don't seek help, either because they don't know where to look or because they feel like they should be okay. The burden of caregiving doesn't just end when a loved one passes. In many ways, it forms into a new kind of struggle. To address these unique challenges faced by caregivers, healthcare systems must prioritize support groups for these individuals. Hudson, a physician with over 15 years of experience, argues that structured interventions such as counseling services and educational programs can mitigate the long-term emotional toll of caregiving. Additionally, policies should be enacted to offer financial assistance and paid leave options for family caregivers, recognizing the inevitable services they provide. Caring for someone with Alzheimer's or terminal illness is one of the most difficult emotional battles a person can face. The slow loss, anticipatory grief, the exhaustion, and the profound toll it takes. When death finally arrives, it doesn't always bring relief, but instead it may invoke a complicated mix of emotions that can linger for years. However, it doesn't have to be this way. With improved support systems, greater awareness, and a shift in how we treat caregivers, we can help alleviate this burden. Grief counseling, education, and stronger community support groups are not luxuries, they're necessities. Caregivers dedicate their lives to helping others, and it's time we ensure they're taken care of too. It's time they're offered a helping hand, and ultimately the scars of loss should not define them for the rest of their lives.